Good afternoon. My name is John Day, and this is going to be my subcutaneous video. The first thing I'm going to do is show you the three most common areas to give a subcutaneous injection as shown on this towel. The first being the anterior aspects of the thighs. The second being the abdominal region from the costal margins to the iliac crest. Last would be the outer posterior aspect of the upper arm. Now that I've shown you the three common areas, I'm going to go into the Pyxis room and pull up Anna's chart so I can give her the right medication. But first, I'm going to hand sanitize. Pulling up Anna's chart, I'm going to see her name, her date of birth, and her allergies. I'm now going to peruse the entire chart until I find the medication that I'm looking for. And here it is, the B12 subcutaneous shot. At this point, I would compare the MAR to the physician's orders to make sure that they're the same. And they are. So now I can go ahead and retrieve the medication from the Pyxis and complete my first set of 5 rights. First, this is indeed Anna's chart. The injection that I need to give is B12. And this says cyanocobalamin, which is the same thing. This needs to be given subcutaneously, which is possible because this is a cyanocobalamin vial. There is going to be some math involved because the doctor wants 500 micrograms given to Anna, but this vial has 1 milligram per milliliter of fluid. And lastly, the doctor wants this given once a month, and the time has come for Anna to receive her next shot. Now that I've completed my first set of 5 rights, I'm going to inspect the vial to make sure it hasn't been tampered with in any way, nor has it expired. It hasn't been tampered with, and it isn't expired. The most important thing I need to know about giving a B12 injection is the reason why it's being given is because the patient is experiencing a B12 deficiency. For this reason, I'm going to have to monitor their folic acid as well as their hemoglobin and hematocrit levels. I'm going to know the medication is working because the patient's B12 levels will increase. And thankfully, there are no side effects nor adverse reactions from getting this medication. Now, as stated earlier, there was some calculation that needed to happen. Because the doctor wants 500 micrograms of medication, but this vial contains 1 milliliter of fluid, which has 1 milligram of medication in it, I'm going to have to give Anna half a milliliter or 0.5 milliliters of fluid. Now that I have the calculation out of the way, I can grab the rest of the materials needed to get the creation of the shot. Seeing as how this is a subcutaneous injection, I'm going to need a 1 milliliter syringe, which is also known as a tuberculin syringe, as well as a 25 gauge 5/8 inch needle. And an alcohol prep pad. Now that I have the materials to assemble the injection, I'm going to do my second set of 5 rights before actually assembling the medication. Once again, this is Anna, B12, or cyanocobalamin, B12 subcutaneously, which is appropriate because this is a cyanocobalamin vial. 500 micrograms, which I will be administering half a milliliter of fluid to Anna. And once a month. And it has been a month since Anna received her last B12 shot. Now that I've completed my second set of 5 rites, I'm going to actually assemble the medication. I'm verbalizing that I've rubbed this rubber stopper as well as the entire top of this vial for 30 seconds and allowed it to completely air dry. To give myself some room for potential air bubbles, I'm going to pull back the plunger to 0.6 milliliters. And then, once I have the excess fluid, I'm going to push the excess fluid back up so I go back to 0.5 milliliters. I am now dispensing the air in the barrel into the air in the vial. Keeping the syringe at eye level, I am now going to pull out 0.6 milliliters of fluid. There is an air bubble in my syringe, so now I am tapping it until it gets back out. Now that I have my medication ready, I'm going to take a medication barcode and place it on the actual injection, being careful not to cover any of the numbers. The other materials that I'm going to need are gauze, gloves, Band-Aid, optional, and another alcohol prep pad. Now that I have all of my materials assembled, I can now go into Anna's room. Can I come in? Hi, Anna. My name is John Day, and I'm going to be your nurse for the next 12 hours. Can I please get your name and your date of birth? Yes, I see that here on your chart, as well as on your armband. Anna, do you have any allergies? Okay. And what happens when you come into contact with penicillin? Okay. Yes, I see that here. And I also see penicillin on your armband as an allergy. So, Anna, the reason why I'm in here today is because I need to give you your B12 shot as prescribed by your doctor. Before we get started, is there anything that you need? Okay, so I see that your bed is locked and in the lowest position, the bed rails are up, and your call bell and phone are within reach. So now I'm going to draw the curtain and we're going to get started. Okay? So, the first thing that I need to do is I need to assess your B12, folic acid, hemoglobin, and hematocrit levels. And I'm going to do that by doing a simple blood draw. The reason why I need to do this is I need to have a baseline present before I administer the B12 shot. Does that make sense? Okay. Thankfully, there are no side effects nor adverse reactions from getting this shot. Your B12 levels are just going to rise, which is exactly what we want it to do. Before I give the shot, however, I need to just go through a checklist called the 5 rights to make sure that I'm giving you the right medication and you are the right patient. Is that okay? Thank you for your understanding. Anna Pawlowski, correct? Yes. Okay. And B12 subcutaneous, which is what's in this injection, and subcutaneous because that's a type of injection. 0.5 milliliter because the doctor wants 500 micrograms to be given to you. And a month has passed. So it's time for your next shot. Before we get started, where would you like to receive the shot this time? In the thigh? Okay. So what I'm going to do is I'm going to raise the bed and lower one of the bed rails just so I have easier access to your thigh. Okay? Thank you. So now I'm going to scan your barcode on your armband. And I'm also going to scan the barcode for the medication. And now I'm going to clean the area. I'm going to verbalize that I've let the area completely air dry before continuing. Are you ready, Anna? I promise it's only going to be a slight pinch. Because Anna is of average size, I can either do it at a 90-degree or a 45-degree angle. At this point, I would enact the safety gauge on the needle and dispose of all of the materials into sharps. Would you like a Band-Aid, Anna? Okay, your choice. I'm just going to take all of my materials and put them in the garbage. The vaccine is already going to be in the sharps container at this point. Okay, Anna, we're done. Now, I'm going to lower the bed and I'm going to put the bed rail back up. Your call bell and your phone were always by your side and the bed was always locked. Is there anything that you need before I go? No? Okay. Well, if you need anything, let me know. Otherwise, I'll be back in an hour. I'm just going to open the curtains per your preference. But before I leave, I'm just going to take a few seconds to document that I gave you the medication at this time and I put an assessment beforehand just to make sure I knew the base levels. I'm also going to put in your MAR that I gave you patient education so you knew why you were getting this medicine in the first place. Okay, so as I stated, if you need anything, just press the call bell. Otherwise, I'm going to be back in another hour. See you later, Anna. And then I close the door. This concludes my subcutaneous video.